This is Dr. Millen Travarkar, a nurse practitioner based here in California in the United States, and I know we have people joining us from all around the world. Welcome. I am going to talk about breast health and functional medicine, and of course, this is Breast Cancer Awareness Month in the United States, and I know everybody has their little pink ribbons. I forgot to wear my pink ribbon today. But that's why I'm talking about breast health, and I want to make sure everybody's getting the care that they should be getting, deserve to get, and to prevent breast cancer. And so the breast is yet to come. Just a little play on words there. So we're going to talk about also not only breast cancer prevention, but a little bit about how functional medicine can help with breast health. Okay, yep, we're getting advanced. Okay, great. So we're going to talk a little bit about statistics, and I think a lot of you, especially in the US, have heard the statistic of 1 in 8 women get breast cancer, about 12.5%. 11% of those cancers are women under 45. And the rate of younger women under 40 getting cancer has doubled since 1976 to 2.9 per 100,000 women. Black women are more likely to get a triple negative breast cancer that is more aggressive and difficult to treat. And unfortunately, during the pandemic, we've seen a 52% drop in the detection of breast cancer. And what this is meaning is people aren't getting their mammograms or getting checked out. And so this is a problem because if people aren't getting examined, are not seeing their healthcare provider, or are more likely to have advanced breast cancer by the time it is detected. So definitely a huge concern. During the pandemic, I know a lot of people have been scared to go into their medical providers, but we need to get those people back in getting screened for all kinds of cancer and just healthcare prevention. So what are some of the risk factors for breast cancer? And these are things to think about if you are in this category. What can what might be some concerns for you, and why you want to be more aggressive about checking. Anybody who hasn't had a child or had their first child after 30, and that's so many of us now, right? I mean, I had my first child at 32. So many of us are in that risk category. If you've never breastfed, breastfeeding provides some protection against breast cancer. Of course, age. As we age, we're at increased risk for cancers. Any history of radiation in your life. That's basically, not just x-rays, but if you've been long-term big exposure. Obesity, being overweight, puts you at risk for lots of cancers, including breast cancer. Alcohol use. Yes, alcohol use is a risk factor for breast cancer. Low activity or exercise. And then I think genetics is really playing a big key sort of role in not only understanding breast cancer, but screening. And so you've heard of the BRCA1, BRCA2 genes, other single nucleotide polymorphisms like the methylation genes and MTHFR, COMT, these are methylation genes, and then our CYP genes, which are the ones that help us process hormones. And we're going to talk a little bit about that in a minute. So, unfortunately, all of us are exposed to toxins all around us, and these can be what's called xenoestrogens, or they're a type of hormone that imitates estrogen, and they can be either synthetic or natural chemical compounds, and lots of preservatives, chemicals, bisphenol A, additives, and here's a list that I just found on the one of my slides. That might help you understand just some of the common things that we use that have toxins in them. And so we need to be really careful in our use of personal products, home products. These are all toxins or xenoestrogens that can interfere with estrogen and, of course, impact your breast cancer health, breast health, and breast cancer risk. So cleaning products, plastics, canned foods, canned tin, sealants, dental sealants, Receipts, yes, receipts. I have really been particular about telling not only patients, my own daughter, not to be handling receipts. Receipts have chemicals on them that act as xenoestrogens. Air, dust, just the toxins in our air and dust, air fresheners, laundry products, home furnishings, rugs, carpets, hair dyes, nail polish and nail polish removers. How many of us get our nails done, right? Hair dyes. How many of us get our hair dyed? Cosmetics, personal products, and there is a huge movement towards clean products, and I really encourage all of my patients to look for clean products, including beauty products. I'm a big fan of Clean Beauty. Beauty Counter is one of my favorite go-tos, but there's so many out there, so many products out there that you could be looking at to change out in your home to prevent these xenoestrogens from increasing your risk of breast cancer. Birth control pills, and we're going to talk about that in a minute. Toys, building materials, photocopiers, printers, food dyes. And we're going to talk about birth control pills because I think this is a big area of controversy. And of course, we know that birth control pills are synthetic estrogens. Basically, anything that you put in your body is not endogenous. Endogenous means it's inside the body, and exogenous means it's outside the body. So anything you're putting into your body, food, whether it's pharmaceuticals, nutraceuticals, these are all exogenous chemicals that you're putting into your body. And estrogens, interestingly, birth control pills are typically made with equine estrogen and progestins. And progestins and equine estrogen are not the same as the estrogen and progesterone in our body. So we call them synthetic. There are bioidentical hormones, and these are thought to be safer. Basically, they mimic exactly the chemical in our body that is processed, which is estradiol and progesterone. So bioidentical hormones are considered to be safer for breast cancer risk. Of course, everybody's an individual, so I wouldn't hang my hat on that. I think I would, of course, evaluate somebody individually. But elevated estrogens can cause breast issues, and synthetic hormones like equine estrogen and progestins can increase your breast cancer risk. So that's where I really like to use the Dutch test as an example of a hormone test where we can look and see how hormones are being metabolized. And I'm going to give you an example of that before we go into a little bit of what I do. And so here is what a Dutch test is. It looks very complicated. I know this page looks all over the place. But if you look at the top, it gives you the top hormone, pregnenolone, and how it converts to all the different steroids in your body. And so they're all connected. You have progesterone, you have on the right sort of upper corner of the page, you have progesterone. On the left top corner, you have testosterone and how testosterone is acting in the body. And then sort of on the right, sort of right side of the page on the bottom is the estrogens that are in your body: estrone, estradiol, and estriol. And estradiol is the main estrogen in your body, and estrone is sort of the more we want to call, more active or probably more bothersome, dangerous. I don't want to call it dangerous, but I'm trying to think of a word here. But the type of estrogen that could convert into more harmful compounds. And estrone, and you can see all the different pathways, how the estrogen is metabolized. And you can see the pie chart there, and we really want the pie chart to be the way it is right now. Looks pretty good, actually. You want all of it to be going into your what we call 2-hydroxy versus the 4-hydroxy or 16-hydroxy pathways. And anyway, the long story short, this is telling me how estrogen's being processed and released from the body. And it's really important for estrogen to be processed. We don't want estrogen to be metabolized poorly because this can affect health. And this is a great test for anybody who's got risk factors, who maybe has any of those the list of risk factors that we just talked about and wants to know, hey, how's my hormones being processed? Am I at risk, higher risk for breast cancer? And you can see the little DNA on the right-hand bottom corner of this page, and that's the 4-hydroxy. That is the more reactive species, the ones that can cause DNA damage, and of course DNA damage is how we have cancer. So I'm always on the lookout for these type of risks for my clients and making sure that they're not at risk for DNA damage and breast cancer. And so I'm going to go into a little bit about why I'm doing this. Is one of the many tests that we do in functional medicine. And functional medicine is an individualized, patient-centered, science-based approach that empowers patients and practitioners like myself to work together. And we're looking for the underlying cause of disease, root cause. And we want to promote optimal wellness, optimal functioning. We want that true health and vitality for patients. And it really requires a detailed understanding of what's happening at the genetic level, biochemical level, what's happening at that cellular level, and what are you doing as far as your environment? How are you living your life? And we use all that data to really direct a personalized treatment plan to have good outcomes. And good outcomes, I don't mean just to solve a symptom, but really get to that root cause and improve health, not just for the short term, but for the long term. And so this holistic model is, really looking at what's happening at the cellular level. And we have the Dutch test is just one of those tests that we use to understand that. And the other piece that I think is really important to taking care of, being taking care of any issue, whether it's breast cancer, breast health, or any other medical condition, is really having a whole person approach. So functional medicine is not just looking at the biochemistry, but we're looking at what other medical issues have you had, surgeries. We're looking at your mental health, trauma and abuse, mind, body, spirit, holistic perspective. We know that it's not just about giving us up, even if it's not a pharmaceutical drug, it's not just about giving a nutraceutical or a herbal medicine or a supplement. We really are looking for deep healing, and we know the mind and spirit is very essential to health. So it's a multimodal therapy. We're using lots of different approaches, whether it's Western, Eastern, Ayurvedic, traditional Chinese medicine. There's a lot of Reiki. I do Reiki myself. So we're energy medicine, using a lot of those approaches to really get to that root cause and help people on a holistic level. So I want to go over a little bit about how we're doing this root cause analysis. I talked a little bit about genes, and we talked a little bit about DNA damage and cancer. We're understanding gene expression. I know I mentioned the pathways for estrogen metabolism, and we are seeing defects in those genetic defects in those pathways, which could increase your risk for breast cancer. If you're not metabolizing estrogen well, you have high levels of estrogen, DNA damage, and boom, breast cancer. So looking for genetics, understanding gene expression, and how we can change the environment so gene expression is optimized is one piece of the functional medicine approach. Others are looking at the gastrointestinal system. We know the gut microbiome is essential to function of the immune system. And again, if your immune system isn't optimized, then you're not fixing that DNA damage, and that's how breast cancer is starting. So we're looking to optimize the gut function, optimize the immune system, decrease toxins. We talked about xenoestrogens. How do we detox the body so that toxins aren't causing DNA damage? Are there any underlying infections which could be causing inflammation? Again, immune system is compromised. Those are that's another piece of the root cause analysis. We also look at the hormones, and I talked a little bit about hormone metabolism. Stress plays a huge factor in disease, and we now know cortisol, when elevated, steals steroid hormones from estrogen, progesterone, testosterone, so that those are not operating the way they should be, our hormones. And so cortisol is impacting health. So that's another piece of the puzzle. And then we're also looking at food, nutrition, lifestyle. Food sensitivities can cause gut issues and inflammation, again, compromise of the immune system. And then if there's any nutritional deficiencies or insufficiencies, that can impact all those pathways we talked about metabolism and how the cells are operating and optimizing health. So that's kind of an overview of the different kinds of analysis we do in functional medicine to enable us to take action. We, usually do a test and we make some changes, change the environment of the body, and we start seeing healing because we're addressing those areas. I forgot to mention that we also look at thyroid. Thyroid is really important, obviously, to overall metabolism and function. So that's another piece of the puzzle that we look at. So that's a little overview of the functional medicine approach and how it relates to breast cancer. I'm going to talk a little bit about some herbs and supplements I like to use with breast health and just in general, depending on obviously a person's individual makeup. We're determining what kind of supplements and nutrients you need. The functional testing will help us determine those, and the herbs will help rebalance the body. Sometimes I'm using curcumin, which is a great anti-inflammatory, and has been shown in multiple studies to be so beneficial. I know my family's from India. Curcumin is a part of our cooking, and so I'm used to using curcumin in everything. I have a bottle of, organic curcumin that I use when I cook, and I add it to a little bit of everything. Melatonin is a powerful antioxidant. I know a lot of you have heard of melatonin being used for sleep, and that's it's also really great for antioxidant or helping protect the body. Resveratrol as well, anti-inflammatory, antioxidant. Quercetin also. Myoinositol is great for diabetes and sugar, lowering sugar. DIM and I3C, you've probably heard a lot of these, are great for estrogen metabolism, as is calcium D-glucarate. So these are some of the herbs that I use with my clients. Just a little list so that you can see how herbs are used and supplements are used in functional medicine. I think the key, one of the key pieces of work that I do with clients is a guided detoxification with herbs and supplements to help remove toxins and endocrine disruptors in the body that contribute to poor breast health. So I'm going to talk a little bit now about breast cancer prevention. We've talked about how functional medicine can help breast cancer or prevent breast cancer, how we can look and optimize health to prevent any breast cancer. But also, you have to do your part, right? We've got to get checked, and you don't know if you have breast cancer unless you get checked. And the first thing I always tell my clients is know your breasts. Do a self breast exam. I know the research isn't clear on self breast exam. It doesn't seem to be helpful. However, so many times I've had clients come to the office, oh, I have a breast lump, I feel something, and boom, they have detected their own breast cancer. So I do feel knowing your breast, knowing your body is really important to understanding any disease that could be starting. And making sure you get a clinical exam yearly is really important. Again, research doesn't show that these clinical breast exams or self breast exams are useful. It really depends on the person who's doing the exam. But again, it's not going to hurt you. It's definitely going to help just in case you find it or a provider finds it. I have found breast lumps and have sent people for evaluation, and we have found small breast cancers that were completely detected early. And so I really feel a clinical breast exam is really important yearly, especially once you're 40 and up. Now, I know we don't do pap smears every year anymore. I mean, in my time when I started, we used to do pap smears yearly. Now we do them every 3 to 5 years, depending on your age. And that has really prevented this sort of the exam that we used to do, the breast exam was part of that. And so I do encourage people to go in yearly. You don't have to get a pap smear, but you can certainly get a breast exam. And I do think it's nice to connect with your provider every year. I really love it when my clients come and see me yearly. They get their physical exam. We do a breast check. If they need a pelvic and a pap, we do that. If they don't want it, we don't do it. But it is great to connect with your provider because going over everything in your health is important with someone and just to feel supported in case something were to happen. Of course, the best thing you can do for preventing breast cancer is to get your mammogram. And we're going to talk about what are the guidelines for mammogram right now. So mammogram is a picture of your breast, and you can see that right here on my slide. It gives us an idea of what's going on in the breast, and it isn't perfect, and we're going to talk about the accuracy in a minute, but we do want women to start getting getting mammograms somewhere between the age of 40 and 50. Now, everybody's different, and I've put the two different organizations, and there's multiple organizations who all have different things to say about when to get your mammogram. I'm always encouraging everyone who has a family history of breast cancer to get the first mammogram somewhere around 35 to 40. If you have, this is for average risk, they encourage women to get their first mammogram between 40 and 44 and start the annual screening. That's the American Cancer Society thinks you should get it every year. And once you hit 55, every 2 years until the age of 75. The United States Preventative Task Force and the American College of Physicians are a little different. They think once you're 50, you should start getting your mammogram every 2 years from 50 to 74. And if you're high risk, you should start between 40 and 49. Well, I just went over all the risk factors, and anybody on that list, if you had a child after 30 or you've never breastfed, I mean, you can imagine pretty much everybody is starting to become high risk. And so typically, that is why I kind of aim for 40 as the starting, and then I work with my clients to figure out if they need to be doing it every year or every 2 years. And everybody's different. Everybody has a different historical background, family history background, different risk factors, and we weigh that all out and decide, okay, what makes sense for you, and that's how we decide. So I would talk to your healthcare provider and come up with a schedule that works for you. And we do have to remember that just getting the mammogram every year is also radiation risk. So you want to be sure that you understand the risk of doing it every year versus every 2 years as well. But it's a great conversation to have and make a decision with your provider. So how good is the mammogram? People always ask me, oh, is a mammogram any good at finding breast cancer? It is actually quite good at finding breast cancer, especially in women over 50. Overall, the sensitivity of mammography is 87%. That means in 100 women, 87 of them will truly have had breast cancer. It correctly identifies women with breast cancer, and it misses about 13% of breast cancers. So really, really good statistics. The chance of having a false positive, and this is one thing to think about as you have your mammograms, is about 7 to 12%. So if you get a mammogram every year, your chance of having a false positive result also goes up. And that means you're looking at getting a biopsy or seeing a breast specialist, and that could increase, that's just an increased risk of intervention when it's unnecessary. So something to think about as you're choosing between 1 and 2 years. I've also had questions about thermography. This comes up quite a bit for patients who are coming to me in functional medicine. Thermography is a test that uses an infrared camera to detect heat patterns on blood flow. And the theory behind this is that the cancer cells multiply and they need more oxygen-rich blood to grow. And so as the blood flow increases, the temperature rises. And by looking at the heat patterns on the breast, we can see if there's a potential for a breast cancer. The great thing about thermography, it doesn't give off radiation like mammography. It uses low dose, mammography uses low dose x-rays, but thermography does not have any radiation. But research hasn't panned out on this, and it isn't as effective as mammography at detecting breast cancer. So I don't recommend it unless somebody's really opposed. If the patient wants to get it, that's up to them. If they're opposed to mammography, I typically am encouraging people to get mammography. But there's always a value in everything, so I wouldn't say thermography is bad. I think there's always a use, and I always love the more tools that I can have to look at things. So that's concludes our presentation on breast health and sort of the functional medicine holistic approach to preventing breast cancer. And I hope you got a greater perspective on how working with a functional medicine provider can help you with your breast health or hormonal health. And of course, feel free to reach out to me if you have any questions for a 15-minute free consult. And there's our phone number and email if you need it. Let me see if we have any questions. If anybody has any questions, I can take those. Look at the Q&A. Thank you for coming to this presentation, and we of course will have a recording available on our website. We have a YouTube channel. Look for it on our social media. I always encourage everybody to join our social media. It's at Lotus IHN on Instagram. I'm also on Facebook. I'm on everything. TikTok. On TikTok, it's at Dr. Millen NP. Please look out for me if you have. I'm doing little talks on TikTok and Instagram, just getting information out there about functional medicine, breast health, hormonal health. I'm also addressing sexual health and fertility. So all of those areas, I have little clips, and just try to help provide information to the greater good, for the greater good. And of course, if you need any help, please reach out to me. I'm going to check one more time if we have any questions. Looks like we don't have any other questions. I want to thank you again for attending. And it's been my pleasure to give you any information on breast health and functional medicine.